Hi, today's topic is about aortic dissections. And aortic dissection is a very rare condition that occurs in 3 people out of 100,000. It is more common in men than women, and this is because of the lifestyle that men lead. And the primary age is above 63 years old, but it must be said that only 10% of the cases occur with people who are 40 years old or younger. And today we will discuss about the history of the aortic dissections, what are the primary causes, we'll review some cases, and we'll talk about the prognosis and treatment. So little history on aortic dissection. This person on the left is the George II of the Great Britain. He used to be a king, and he's important in our case because the first cases of aortic dissection that has been written down in the medical books was done because of him, because he died, and they did a body examination on his corpse, and they found out that he had dissected aorta. And the person on the right is Dr. Michael DeBakey. He is the person that in 1950s introduced a surgery to try to fix the aortic dissections. So some information on the pathophysiology of aortic dissection. There are several leading causes for it. One of the biggest one is hypertension, then major trauma, smoking, cocaine use. So what happens to cause the aortic dissection? Primarily the innermost layer of the aorta, which is called intima, becomes weak, and then blood starts to pour in the area between the media and intima. From the blood pressure, the blood pressure becomes so big that it literally rips them apart from each other, and it creates the true and the false lumens. And it must be said that it can go all the way down to the bifurcation of the abdominal aorta. Dissections that go all the way down to the iliac bifurcation are called the antegrade dissections, and those that propagate towards the aortic root are retrograde, so basically the opposite of the flow. There are two main types of aortic dissections, type A and B. The type A is happens in the ascending aorta, and in this picture on the right we can see it is marked with the golden color, and the type B happens in the descending aorta, which is marked with the golden color again. And what are some of the signs and how do we diagnose it? First of all, the biggest sign is a severe stabbing chest pain. It can easily be confused with a heart attack, so correct diagnostic tools the correct diagnostic tool should be used. Initially, chest x-ray will be obtained, and we can see in this example right here, the patient has a cardiomegaly. That's just a sign, doesn't give us an answer what's happening. That's why they might end up getting a D-dimer test done, and if the numbers are higher, then CT exam will be performed. Other modalities can be done to rule out aortic dissection. MRI and ultrasound can be used too, but the CT is usually the go-to modality for it. And this is our first case that we are looking at. This is a patient that was 50 years old, and here we can see the type A aortic dissection, and we can see where the false lumen and the true lumen are, and they are literally divided from each other. And then it must be said that in this image, iodine contrast media was used, and using iodine for dissections is usually a good idea because it just lights them up and it makes it easier to distinguish which one of these is the true lumen and which one is the false lumen. These two images are obtained from the same patient, and here we see an aortic dissection that is ruptured. Here we can see where the aortic dissection was, and we can see how that contrast media is flowing into the pericardium of the patient, causing cardiac tamponade. In these kinds of cases, patient needs to get an immediate surgery to ensure that the leakage is closed, contrast media is cleaned, and to open the true lumen more if it's possible. And then we can see on here on the coronal image where the dissection is, and here is the contrast pouring into the heart. This is a 3D reconstruction of the same patient, and here is the contrast that is pouring in the pericardial area. And these two images are obtained from the same patient, and this is a type B dissection. It is rising at the level of the right subclavian artery. Here's that one, and here is a dissection that starts to rise from here, and it keeps on going down the descending aorta. Here is the true lumen, false lumen, and it keeps on going down. And again, same patient, we can see how much lower it's going, and it's getting like mid-heart area. And I like to show you MRA images of the aortic dissection happening in the abdominal aorta. This first one on the left is AP image, and we can see where the dissection happens, and it is going to the right common iliac artery, and the gadolinium contrast is filling right that area. And this is an oblique image. We can see how much higher it's going. It's getting to the level of the left renal artery. So what's the treatment? The treatment usually involves medications and surgery. For the medications, we give drugs to decrease the hypertension, make sure that there is no increased pressure in the arteries. Besides, beta blockers can be given to decrease the heartbeats, and vasodilators can be used to decrease the outwards pressure on the arterial walls. This is going to make sure that the dissection that is already there doesn't become any much longer or bigger or even rupture. Surgical intervention can be used too, and this is done to divert as much blood into the true lumen of the aorta as possible. Unfortunately, the prognosis for the aortic dissection is pretty bad. 40% of the patients will die without getting to the hospital. 5 to 20% of those people that get to the hospital will die during the surgery, and 75% will die within the 2 weeks following the surgery and meds. It must be said that if there is a thoracic dissection and we are very aggressive with our treatment for 30 days, survival rate can be up to 90%, these numbers are still disputed, but that's one source that I found. And these are my references that I use for this presentation. Thank you.